They are much more susceptible to spinal fractures, even with trivial injuries, compared to somebody who does not have ankylosing spondylitis.
For 16 years, Dr. Gary Vilk has practiced and taught emergency medicine from the perspective of an ER physician and as a first response doctor.
Ankylosing spondylitis presents in a number of different areas. Almost universally are the sacroiliac joints, which are affected basically 100% of the time, and that's part of the diagnosis of the disease. The lumbosacral region is diagnosed about 50% of the time in patients. The rib-spine junction, that's the area where the ribs meet the spine in the back, that's about 70% of the time. Hips and shoulders are involved about 30% each. The neck is involved 3/4 of the time, and eyes are involved almost 40% of the time. At times, it will even cause increased curvature of the spine to the point where people can't look up or forward, and it can even become what's called like a bamboo spine. This is a normal spine, the thoracic region in a patient without any ankylosing spondylitis. And what you're seeing here is the normal disc spaces. Again, no calcification, nice clean discs in between each of the vertebral bodies. Here you see the calcification of an AS patient. It's one long bone. It's calcified all the way up, and again, it looks a bit like bamboo. Again, the name bamboo spine.
With an AS patient reporting back pain, standard protocol treatment must be modified.
You're going to feel me. I'm going to run my fingers down your neck and your back, okay? I'm just going to, gonna tell me if you have any pain, okay?
Okay.
Is it hurting along here?
That's okay.
No? Anything hurting along here?
Yeah.
Okay. Anywhere else further down here?
Yeah, that hurts a bit.
Yeah? Can you wiggle your toes on your left foot for me?
Yeah.
Okay. Do you feel my partner touching your foot?
Yeah.
When the pre-hospital provider suspects a back injury in a patient with AS, meaning they had some form of trauma and they have some pain in that area, in my mind, they have a fracture until proven otherwise.
So what we're going to do, guys, we're going to get the scoop stretcher and some extra pillows and blankets. We're going to splint him in place. We're not going to move him at all. We're not going to roll him on his back or anything like that.
Now, how come we're not using the C-collar and backboard?
Well, because he has ankylosing spondylitis.
Greg has learned about AS, and continuing to listen to the patient can guide the team in packaging the patient for extrication. To minimize spine movement, a scoop will be used in lieu of a spine board.
All right, Jim, so we're going to slide this underneath you, okay? You're just going to feel it kind of slide up underneath your body.
Okay.
All right?
Yeah.
And we're going to try and get...
Padding goes under the patient's head, between his legs to support his injured leg, in front and in back of him.
Just going to wrap your arm around that right there, Jim. Perfect.
Since he reported he's more comfortable on his side, he's left that way with his legs curled up. Extending them to be strapped down could cause damage. Further, a cervical collar is not used for concern straightening the neck to apply it could also cause damage.
In a patient with curvature and AS, they will have a spine that looks like this. If you try to straighten them out, you could take something that's either a natural fracture or a hairline fracture or no fracture at all and snap that brittle spine and you get something like this. This is a wedge fracture that was, or a wedged out lesion actually, that got pulled out. A hairline fracture is not a problem because the cord usually isn't impacted. But when you start bending the spine out there, you start pinching the cord and causing neurological damage and disease. So this is the picture that you should think about when you're going to try to snap somebody's back by placing them flat onto a backboard.
If you don't know a person has ankylosing spondylitis, there's often no way to spot it. Extreme curvature of the spine can be present, but it's the exception rather than the norm. While the symptoms are subtle, the damage that can be caused by improper handling of people with AS can be devastating. Next, you'll meet people who know firsthand how our traditional protocols may do more harm than good.
A guiding principle for all medical providers is do no harm. In most cases, things go right, but events can go wrong. As Lori Savage, Executive Director of the Spondylitis Association of America, explains.
We were contacted by an elderly lady whose husband had suffered from long-standing severe spondylitis. This made his spine very fragile. The EMTs who came to his rescue following a heart attack were not aware of this condition, and so they did what they were trained to do, and they, during intubation of this gentleman, in order to save his life following the heart attack, they inadvertently fractured his cervical spine. With this program, it is our intent to encourage emergency medical providers to learn about ankylosing spondylitis in order to make sure that this never happens again in the future.
Ankylosing spondylitis hit Leslie Upledger Ray as a teenager, but it took years of testing before she knew what the problem was. AS is simply very difficult to diagnose in women and teens.
It's in my knees, it's in my hips. My greater trochanters are probably getting ready to go. Right now, I have almost complete bony ankylosis in my temporomandibular joints. And contrary to what you think of in terms of TMJ, my joint isn't very loose. It's almost frozen. If a first responder comes on me and I'm unconscious or in obvious trauma, the first problem is going to be intubation, because if they try and open my mouth and then try and insert a tube, first of all, the tool that they would use to open my mouth could very easily break my jaw, my joint right there, which of course causes problems. The second step in an intubation, you want to tilt a head back. Because I have problems in my upper cervical area, it could easily cause spinal cord damage and fracture. My rib is pretty much rigid. Compression on my chest would very likely result in fractures, rib cage fractures, which could of course cause all kinds of damage.
To ensure she receives correct care in an emergency, Leslie wears a medical bracelet with the words "brittle spine, see thumb drive" on it. The thumb drive is always with her and contains x-rays and a brief medical history, including that she takes biologic medications which suppress her immune system.
These are challenging patients, and so if they do verbalize that they have difficulty with their jaw or their TMJs, expect that if an airway needs to be managed down the road, that it's going to be a difficult airway, and most of the time the best thing for that type of person is supportive ventilations until a fiber optic intubation can be done in the emergency department.